IT is an 18-year-old African-American male who was diagnosed with sickle cell anemia when he was 11 months old. As an infant, his hands and feet were swollen. He fought multiple infections such as pneumonia, had several painful episodes and chronic pain in his arms and legs. Recently, after a strenuous workout session, he realized that his arms and legs hurt more than usual. He took ibuprofen to help with the pain, but noticed that the pain was intensifying.
All of his symptoms fit the criteria of sickle cell anemia. Symptoms of sickle cell anemia include episodes of pain called crises, swelling of hands and feet, delayed growth, fever, vision problems, frequent infections, fatigue, and irritability.
Sickle cell anemia is an inherited red blood cell disorder. People with sickle cell anemia have abnormal hemoglobin in their red blood cells and are deformed, which makes the body unable to carry necessary amounts of oxygen. The red blood cells are sickled and become hard and sticky, and they get stuck when traveling through small blood vessels, causing clogs and blockages in the blood flow. Unlike normal red blood cells, they die quickly.
People with sickle cell anemia are at risk for stroke, acute chest syndrome, a disease that lowers the level of oxygen in blood, hypertension, organ damage, blindness, leg ulcers, and jaundice because the liver is unable to process an increase in dead blood cells. They are also more susceptible to depression, stress, anxiety, and pneumonia.
Sickle cell anemia patients experience painful episodes, which is when red blood cells get clogged, causing mild to severe pain. They should avoid places where they are exposed to high altitudes such as flying and mountain climbing, and avoid being too hot or too cold. Areas of low oxygen levels such as large lakes or oceans will exacerbate their symptoms. Other triggers include dehydration and stress.
The best treatment for patients with sickle cell anemia is no different than treating chronic pain conditions in which pain relievers are most often prescribed. Hydroxyurea therapy is recommended for sickle cell patients that have recurring episodes because it reduces the pain and stimulates hemoglobin production. It increases the water content of red blood cells and allows it to flow more easily in small blood vessels.
Sickle cell anemia affects 100,000 Americans, and it is more common among African descent. 1 in 13 African American babies are born with the sickle cell trait, and it affects 1 in 400 African American births. There is no cure for sickle cell anemia, and it worsens over time. This is a major public health concern, and in 2005, the medical expenditure for children with sickle cell anemia cost an average of $11,702 per child.
Hey Mom! Sickle cell anemia is a disease where the red blood cells are deformed, making the body unable to carry necessary amounts of oxygen. This causes fatigue and episodes of chronic pain. Intense exercise, as well as dehydration, can worsen these symptoms as the body struggles to get oxygen to the rest of the body. That's why it's important to stay hydrated and to stop any
Lacking oxygen, sickle cell anemia takes your breath away.
Created using Powtoon.